10 minutes to save a life, surgery at 35,000 feet. A true story of courage, improvisation, and a race against time. Welcome to Medley with Dr. Muneer. In 1995, British Airways Flight 032 took off from Hong Kong, heading to London. Among the passengers were two doctors, Dr. Wallace and Dr. Wong. And sitting just a few rows away, a woman with a hidden injury. Before takeoff, she complained of arm pain. Wallace and Wong, both surgeons, gave her a quick check. She said she'd fallen off a bike. They assumed it was just a bicycle, and diagnosed a fractured arm. After takeoff, they returned to her with a splint. But then, everything changed. About 2 hours into the flight, she began gasping for air. Crushing chest pain. Strained breathing. This wasn't a simple fracture anymore. They soon learned the truth. She hadn't fallen from a bicycle, but had been thrown from a motorcycle in a crash. She had likely downplayed her injuries to avoid being removed from the flight. Now, she was showing signs of a tension pneumothorax, a collapsed lung under pressure. Her ribs were fractured, and air was building up inside her chest. If they didn't act fast, her heart and remaining lung would be crushed. She'd die before they reached the next airport. Landing wasn't an option. The pressure change during descent could kill her instantly. There was only one choice left, emergency surgery, mid-air. But there was no proper chest tube. No surgical instruments. No sterile field. Just the plane's limited medical kit, and two determined doctors. They got creative. The catheter was too soft, so they stiffened it with a metal coat hanger. They made a check valve from a water bottle, holes poked into the cap. They sterilized the tools, with cognac from the beverage cart. They numbed the site with lidocaine, the only anesthetic on board. There were no clamps. So Wong held the incision open with, believe it or not, a knife and fork. Wallace inserted the improvised chest tube. 10 minutes. That's all it took. They released the trapped air. Her lung re-inflated. She could breathe again. And just like that, she was stable. She spent the rest of the flight eating dinner and watching movies, as if nothing had happened. When the plane landed safely in London, the story didn't end. Wallace and Wong published the case in the British Medical Journal, a testament to in-flight medical courage. Wallace later testified before a British parliamentary committee about the poor state of onboard medical equipment. He warned that most US airline kits didn't even carry aspirin. And that such a surgery would have been impossible under those conditions. This wasn't just a case of quick thinking. It was a story of responsibility. Resourcefulness. Humanity. Two surgeons, trained for the oar, stepping up in the sky. Because sometimes, a scalpel isn't what saves a life. Sometimes, it's a coat hanger, a water bottle, and the will to act. Thank you for watching this incredible true story of survival. If you believe more people should hear real stories of courage in medicine, like, share, and subscribe to Medley with Dr. Muneer, where every story is a journey through life and beyond.